picked up really amazingly around.
Or have you reached capacity for shots? I mean, are there any things you're doing to get more shots into more arms? There's, again, I know you're the minister in charge of vaccines, so it's the Olympics are not in your brief, but there is a nexus between the vaccines and the virus and the fact that there are tens of thousands of people coming in with a bit different quarantine requirements than normal for Japan, these Olympic visitors. The people that we've been talking to are worried about rising cases, but there's also worry among scientists about a Tokyo variant, like some sort of new wrinkle that this nexus of all these people coming in and a population that's still 75% not vaccinated, the possibility that could break out. Is that a calculation that you're taking into account? And what, if anything, are you thinking about ways to make sure that doesn't happen?
Those who have come to Japan for the Olympic Games in the bubble, and they don't really mix with the Japanese general public. So there are some cases that tested positive in the PCR testing, but they have been isolated. And I think the organizing committee is taking care of them fairly well, although there are some cases that they wandered around into the street, several cases of that, I admit, but there have not been any cases that are those tested positive who came out of Japan transmitting virus to the general public in Japan. I don't think there has any case relating to the Olympic Games. So we're not really worried about that issues. But now I think we are finishing up senior. Here in Japan, we see the rise of the new infection numbers. But if you look at numbers, there are very few senior people. And those who get really seriously affected, the number of the senior people are getting less and less. So I think it's because of the vaccination. We are saving lives of the senior people. On the other hand, people in 20s and 30s getting infected, those numbers are rising. So we are starting vaccinating people 64 or younger. And I think my next goal is to raise the rate of vaccination for the younger generation. If we could vaccinate 20s or people in 30s for 80% or higher, it would be a good number for me.
You met with Pfizer CEO, Mr. Kono.
Even if we slow down a little bit, I'm okay. Rather, we need to reach out to the younger people so that they would feel that it's necessary for them to get vaccinated. So I'm sending out a message to the mayors. Don't worry about the speed, but please reach out to the younger people in your city and convince them it's a good idea to get vaccinated.
Group of maybe high school or
Facebook. The senior people get information from television. We need to do global clinical testing for pandemic. If it's something like a seasonal flu, we might do it different way. But if something like Ebola spreading and we really need to hurry up, I think we need to make decisions. And if that happens, I'm very happy to go along with the global clinical testing rather than adding some special clinical testing on Japan, on the Japanese.
So it's too early.
So if we could redo this, I think we might have skipped
time, or do you have any, give shots to everyone who wish to get vaccinated by October or November?